I'm live. Hello again. There's one person viewing. That's so sweet. Hi. Hi to those that are stepping in now. How's everyone's day? It's noon in Los Angeles. I wish I could see like a map of people and where where they are. It's so trippy that I can just press a button and we're sitting here in real time. I am well. I was just checking in with myself before I went live and feel good. Very excited to have this conversation today. I don't know who was able to read the article before, but if not, we're gonna cover all of it. And I'm gonna see now. Here we go. Oh, I see. The thrill television. Here we go. Christy's gonna come in now, and we'll talk and answer your questions if you have any. Hi.
Hi, Brie. How are you?
Oh, I'm so well. How are you?
I'm doing great.
Good. I'm so grateful to you. I'm so grateful for the article that you wrote and taking the time to speak with me. I just appreciated so much your transparency and honesty through your experience.
Absolutely. Thanks for having me.
Yeah.
It's an important conversation, so I'm just happy that I'm here and that you're doing it on your platform, which is major. So thanks.
Yeah. So for those stepping in that don't know what's happening, what we're gonna these series have been about how this virus has highlighted systems that were already not working.
Right.
It's not that we're seeing a ton of action happening out in the world that is bringing up tons of new problems. It seems like it's just exaggerating and creating really intense life and death stakes in systems that maybe we weren't noticing or weren't taking seriously enough. So do you want to start by, Christy, by saying a little bit about yourself and
Absolutely, yeah.
your experience and what we're talking about?
Right, yeah. So my name is Christy DeGallerie. I'm a writer, producer, certified researcher, and most recently I tested positive for COVID-19 about 9 weeks ago. And I had a few ER visits, but my first ER visit was alarming. And it can be discouraging for Black and brown people already because you see the news and you see the alarming racial disparities and how many of us are dying from the disease. So it's already kind of discouraging and frightening to go to the ER because you're worried about the experience before it even happened. But when I did get to the ER, I immediately felt self-conscious of how I was displaying my pain and wondering if, are they going to believe that this is happening? Do I not look like how I'm feeling? Should I look more sick? Should I bend over? Like what should I do so that I can be taken seriously? And just to have my temperature taken was a struggle, just to prove that I had a fever. Outside of being tested, just to prove that I had a fever was difficult. And in that moment, I didn't want to think about any kind of implicit racial biases because, you're not feeling well. And when someone's not feeling well, you just want to think about getting better or think about the uncertainty that you have and think about, being sick. But I tried my best to remove that, and I had to face that, okay, this is happening. This is happening to me. Something's off, and we have to call it what it is, and it's having implicit racial biases in the healthcare system. So basically, if no one knows what that means, it's pretty much stereotypes that have been implemented in our systems for hundreds and hundreds of years. And for me, and being a Black person, that can mean that Maybe my pain tolerance is not what people may think, or I have a lot of strength, even though I don't. I'm actually a very vulnerable and weak person. But who you're navigating with, those stereotypes may come out either subconsciously or not. May come out while you're having a dialogue with a patient of color. So for me, I realized that was happening. When I left the ER, I found a support group, and I was really excited that I found this support group, and I joined it, but there was a big disconnect. And the disconnect was I saw all of my white peers and my white counterparts having stories that when they left the ER, when they left the hospital, they were met with medications and prescriptions. And I kind of felt crazy. I was like, there's no way that this is happening, because I didn't get that experience. That no one ever told me, hey, this is a great prescription for you. That never happened to me. So while I was in the support group, I kind of waved like an SOS flag to the other POCs in the group, just to see if I was, if they related to my misunderstandings of what was happening, the disconnect in the group. And I was not alone. And from there, we formed a private chat, and I said, I know that this is a huge thing that's happening. I mean, just for New York alone, Black and Latino people are twice as likely to die from this virus than our white peers. And that's not our fault. That's the system that's in place. Mm-hmm. And, not that I can terminate the system, and nor is it my responsibility as being an oppressed person to terminate a system. But when I find these gaps, when I find these disconnects, and when I find my anger, which is very valid, we should all be angry right now. Mm-hmm. Every single one of us, regardless of, everyone should be angry of what's happening and what's being highlighted during this pandemic. But with that anger, I wanted to find, whether it was temporary or not, a solution. And I thought, where can I have this validation that I didn't seek, that I didn't find in the emergency room or from the doctor that I was talking to? So I formed this support group for Black and brown people, and it started out with 5 of us. Now, I would say there's probably like 1,500. Which is massive, which is huge. And the channels don't just consist of those that have COVID-19, but those that have lost from this virus. We have people that also are medical professionals in the group, which I thought creating a channel within the group was very important for medical professionals, because I wanted to not only express my concern and my frustrations, but I wanted to kind of humanize the situation for Black and brown nurses as well, and see like what their perspective was. And why I chose to do a channel for medical professionals was because when I went back to the ER, there was a nurse that was very frantic. And I was like, oh God, this isn't happening again. And she was very frantic, and she was running around, and I noticed in that moment that she was sharing the same anxiety that I was. And I just blurted out, I'm anxious, I'm in fear, I'm terrified, and people that look like us are dying. Like, I'm scared of this. And there's like a veil that kind of disappeared, this barrier that kind of shifted, and I saw her body language relax. And, I just began to talk to her like, we're both in this system, and there was like this pyramid where, you're also not getting something out of this. We're both not benefiting from something that should be helping us. And what I mean by humanizing the situation is because, while it's her job, she's also scared. And she's also at risk. And finding out that her daughter had COVID-19, and finding out that she's isolated from her kids, and me being a parent, how I was also isolated from her kids. So while there were two different people, two different situations, it was two people of color that were going through the same fears. And so from that experience, I was like, I have to create a channel for Black and brown medical professionals, because they're also getting the short end of the stick. And then also relay how we feel. And the thing with hospitals, there are definitely racial bias trainings. I don't know if all hospitals, but many do have these racial bias trainings. And the thing about it is they try to reduce the issue instead of remove it. And to reduce an issue, we make it smaller, but that doesn't mean it goes away. So in order to remove that issue is bigger than just reducing it. Reducing it is kind of, what we did before, and then the pandemic happens, and then we see it. So that's why reducing it doesn't work. But for the meantime, for what I thought was a solution through my anger, was to create the support group, and why it was so necessary and important, because once I did that, once I saw what my community was going through, which I already knew, but once you have that interaction, you just feel so less alone.
Yeah.
And I think that was just really important for all of us involved, and seeing that it was caretakers also that were struggling on a cellular level. So even if we're not being diagnosed with COVID-19, Black and brown people are still on a cellular level, this is impacting them and their mental health. And with that, creates a future that is with more uncertainties. So
and building upon distrust that was already there, and then adding. Yeah.
Exactly. And that's why having support, and I suggest everyone to create a support group for their community, and for where they feel that there is a disconnect in certain spaces. And if you feel that, I say go for it. I say 110% go, and it doesn't have to be huge. Like 3 people as a support group. That's enough. But something that I remind the members in the support group is that these racial disparities, realizing that there are, you look at Louisiana, you look at Michigan, and you see that, you look at New York, and you see that it is just alarming how we are twice more likely to die than our white counterparts. And seeing that, it causes this discouragement. It causes this, what's wrong with me? And so I remind the members in the group that this is not us. That we're doing everything that we can for ourselves, and this is not us. This is all preventable, and we're not the ones that are creating this for ourselves, and we're not to blame for this. And that's really important, because immediately when you see that your community is more likely to die from something, you're wondering, is it us? What are we doing wrong? So to continue to remind the members that it's not us. We're in this system that unfortunately is carrying implicit biases and stereotypes where we aren't really listened to, and our pain usually isn't equal to our white counterparts. So with that, I find that to be a good reminder, and I find that with those solutions of a support group, also for us to advocate for ourselves, which can be, again, extremely hard for POC, because walking in immediately, you're already discouraged. You're anticipating that you're not going to be listened to, even though you should be focusing on your health. It's now become a privilege to walk into an ER and only focus on your health. With Black and brown people walking into an ER, you're thinking about 50 other things that come before the pain that you're feeling. And all of those things conclude to race. And it sucks. It sucks. But I always say to advocate for yourselves. And one of the things that I've noticed is that as soon as I'm vulnerable, And even if it sounds silly, as soon as I'm vulnerable, I'm like, I will shout, I'm in pain. I'm hurting. I need someone to look at me. I'm not feeling well. And this is not to say that this will be the cure to ending the racial disparities, but just to see that maybe something can shift when we advocate for ourselves. And I say, I'm in pain. I'm very vulnerable. I announce that I'm anxious. I announce that I'm in fear. I announce that I think I'm going to die. And I demand that my needs be met. And when that happens, it's, you know, that it's not you. You start to realize you're saying all these things, and you realize, okay, I've been advocating for myself. It kind of breaks down the discouragement that you had about yourself, or the self-consciousness that you had about yourself. I also recommend people in the group to bring a friend with you. Usually a friend with privilege. I think having a set of eyes, another set of eyes and ears, really helps with situations.
You talked about as well with the quarantine, that having someone on FaceTime, if you're not quarantined with someone that's viewed with privilege,
Right.
that you can FaceTime or have a phone call.
I think it's so important to FaceTime. I had a friend FaceTime with me. There were symptoms that I forgot that I had that my friend remembered, and it was important just to, oh yeah, say this to the doctor, or turn the phone around and have your friend talk to the doctor. You're allowed to do that. Don't let anyone tell you can't do that. You are 110% allowed to do that. It would be just as if you brought a friend to the doctor with you. The same thing, just virtually. And I think that with the privileges that we have, that it's our responsibility to look out for each other. And so with that, if you have that privilege, if you can just, it's just that say, hey, do you need something? And in that moment, yeah.
Oh shoot,
I do.
Lost you. Oh, there you are. It's breaking up a little bit. Hopefully it's not doing that for other people.
You're capable to write things down. I definitely think that works. Oh, am I back?
Hold on, Christy. Hold on. It's showing like a load. Oh, there you are. Okay, great.
Oh,
maybe back it up just in case other people missed it. Maybe back it up a minute if you remember what you said.
Yeah. So I was saying also, if you are capable of writing your symptoms down, if you're capable of writing your pain down, I say write that down and show the doctor, because also you can, again, feel really lumping in your throat, not knowing if you're going to.
It's still, sorry, Christy, to interrupt.
And it's scary. It's a high tension. Oh, is it?
Are you there? Neither of us moved. I'm trying to think of, should we close out and start again? You're saying such important information. I don't want it to get lost. Yeah. People are saying that's breaking up on their end too. I'm going to post this and okay. Sorry about that. It's live. So, I'm going to wait and see. I don't know how long it'll take for Christy to jump back in. Let's see. Oh, there we go. Connecting. Hi.
Can you hear me? Can you see me?
Yes, now I can. Yes.
Oh my God.
Like the most crucial information cutting out. So, maybe back it up a minute.
Yeah, let's rewind.
Okay, cool.
So I definitely, we mentioned virtually talking to a friend.
Mm-hmm.
And I also mentioned writing your symptoms down, writing your pain down, because again, for POC, entering, you kind of do get shell-shocked, and it's a fast-paced environment, and you kind of are like, already, again, like I said, the subconsciousness, you feel discouraged. And sometimes, for me, this has happened for me. I went to the ER and forgot half of the things that were happening to me
Mm-hmm.
because I was thinking about all the other things that could possibly go wrong. So writing it down before you leave the house and having it in your back pocket, and even if you don't want to give it to the doctor, but just to read for yourself,
Mm-hmm.
is always a great thing. Um, and and yeah, and there's this conversation is so deep regarding the racial disparities, and there are, to support this conversation, if anyone wants to know, that there are books that can carry this on, and there's a book called Just Medicine: A Cure for Racial Inequality of American Healthcare by.
I'm gonna write these down.
Oh yeah, for
Just
sure.
just just medicine?
Yeah, Just Medicine. It's a cure for racial inequality in American healthcare by Dana Bowen Matthews.
Okay.
And another great recommendation that can carry this conversation is Medical Apartheid by Harriet Washington.
Okay.
Both great. Like this conversation we're having is like a starter pack, but that, like, those books really carry on and dissect how Black and brown people are feeling, how they're being treated, the systems that are in place that that again keep us in fear of even going to get help, and that's something that we don't want. And again, talking about how the racial trainings focus on reducing the racial disparities when we need to focus on removing it.
Right. Do you think, in hearing you talk about the training, I'm wondering if it's just like it's about living it and not so much about completing a training course.
Yeah.
Does that sound right?
Yeah. Yeah.
Yeah.
It's you know, and I think it's you know, I think unfortunately it's kind of checking it off a list. Hey, we did this, but there has to be action involved when it comes to any kind of training. There has to be action involved. You know, we can talk about it all day, but if we don't have some kind of solution, if we don't break down those barriers, you know, we're going to continue to lose Black and brown people, and this pandemic, I mean, you know, this has always happened for any kind of devastating medical issue where Black and brown people are always, the numbers are just alarming. And how long are we going to continue to see this? Like, we can't wait for the next pandemic for this to happen. So it's really important for us to focus on what we can do for Black and brown communities. And again, that reminder that it's not the oppressed fault for getting sick. That's the biggest reminder. And I know a lot of people feel that way because at times I felt that way. This is my fault. If something happens to me, it's my fault. But it's not. And again, I think with privilege comes responsibility, and I have privilege and I have responsibility, which is why I wanted to start the support group, because I knew that with any kind of platform, with any kind of voice, that we can have a bigger conversation, and the people in my community can be seen by one another, and what they were seeking when they, you know, were in the ER, they can get validation in community with us.
What's the process for people to join the support group?
So there's a link in my bio, and so we do it by numbers. So the first 15, pretty much the first 15 a day will be swept in. And there's a co-admin, so it's me or co-admin, and they handle all of the pretty much vetting, because we do get time. So pretty much vetting and the rules. There's rules when you sign up, just so that we don't scare people. And there's no medical advice within the group, but there is just but there are medical professionals, and even the medical kind of advice. But it's also for them to vent. So it's pretty much different channels. Caretaker, if you are someone that lost someone to COVID, you can you can join. It's if you have victories and success stories, which is something that I love, which is something that gave me hope while I was sick. Those success stories bring everyone in the group that feel discouraged hope that there's light
Oh shoot, the
at the end
signal's
of the
going out
tunnel.
again. We can hear you though, Christy, but it's just, oh, there, now you're back. Are you there? Yeah.
So yeah,
Could hear everything. It just got frozen. Yes. Oh no.
oh, we got frozen.
Yeah, hold on. Let's see. It feels like it's like
And you got
it needs
those
to
books.
like catch up to you in real time. Okay, now you're back.
Am I back? Okay, great.
I think so. It cuts out a little bit, but we could hear all of your audio.
And yeah, and to carry this conversation, important. But again, to carry this conversation, those books that I mentioned are really, really important and dissect more into this conversation. And I re-advise and recommend everyone to read those books.
Yeah, I'll post
because I guess
the,
it's like a starter pack. This is an introduction into something
our
that
signals
is
are out of sync now.
that's
But I'll
really
post the links for the
important
books
and
as long
something
as
that's damaging. No, it's okay. Great. That's good. Yeah, I mean, I think I covered so much, and like, there's so many people that have these stories, and it's just important to them. And oh, you cut out. No, you're back.
I cut out. I know the signal. This is this is the thing
There
I
you
love
are.
about live.
Can you hear me?
We don't know. Anything can happen.
Okay, great.
Yeah. People are saying maybe if you disconnect another device, but I don't know how that works. I don't know how the I don't know technology.
Ah!
I know.
Can you hear me?
Yeah, I can. Is there anything else, just since the signal's cutting out, that you want to add or wrap up with?
Okay.
But otherwise, I feel like you covered everything we talked about on the phone that feels really important and for this period
Anything can happen.
Shoot, it cut out again. Okay, I'm gonna end and we'll do a wrap up. Oh, wait. Yeah, we will. Okay, I don't know. We're not talking.